Be it a large battleship or a small boat, the same magnetic compass facilitates orientation as the vessel navigates around the globe. The size of the vessel is immaterial. Similarly, be it a large species such as a dinosaur or a small man, the vestibular apparatus helps provide orientation and balance. Again, the size does not matter. Walking, playing, climbing, sitting, standing, and even sleeping. In virtually every small movement in daily life, balance is a fundamental requirement of the human body. The human body is an incredible machine. It has an inbuilt mechanism to maintain balance in whatever it does. And when this mechanism functions erratically, we experience dizziness. Dizziness is the chief complaint of 10 million patients in India who visit physicians every year. In simple terms, dizziness or vertigo can be defined as an illusion of movement. Currently, research on vertigo is increasing due to its impact on a patient's well-being. Vertigo disturbs the routine activities of individuals and might even shake their confidence. It adversely impacts quality of life and increases the risk of falling, especially among the elderly. Given the misery that patients undergo, physicians find it challenging as well as demanding to treat this condition. To maintain balance, the human body uses 3 different sensory systems that work in concert. The visual senses, the sense of proprioception from skin, joints and muscles, and the vestibular system. The brain interprets and processes the information from all the 3 systems and helps the body maintain balance. The vestibular system has a specialized receptor organ in the inner ear called the labyrinth. This connects to the vestibular nuclei situated in the brain stem through the vestibular nerve. The vestibular nuclei relay information to the cerebral cortex, cerebellum, spinal cord, and cranial nerves, especially the cranial nerve 3, oculomotor, 4, trochlea, and 6, abducens, which control the movement of the extraocular muscles. Let us take a closer look at the labyrinth. The labyrinth in each ear comprises of the cochlea and the vestibular apparatus. The vestibular apparatus consists of 3 semicircular canals and an otolithic apparatus that contains a utricle and a saccule on each side. The ampullae of the semicircular canals and maculae of the utricle and saccule contains hair cells. The hair cells are mechanoreceptors that identify and detect changes in the position of the head and or body when an individual is at rest or in motion. Each hair cell on its apical end has 1 kinocilium and many stereocilia. With the rotation of the head, the endolymph in the semicircular canals shifts, causing the stereocilia and kinocilium to bend. Also, when the head is tilted or the body position is changed with respect to gravity, the otoconia in the otolithic apparatus gets displaced, causing the hair cells to bend. As with any other cell, ionic exchange is critical for signal transduction across the vestibular hair cell membrane. Calcium is recognized as an important element in the process of signal transduction across the basal sides of the inner hair cells. It hence has a vital role in maintaining balance in the human body. Let us explore why. In response to the movement of the head towards one side, say to the left, the hair cell stereocilia are deflected towards the kinocilium. This causes potassium channels in the apical portion of the stereocilia and kinocilium to open. Potassium ions flow into the cell from the endolymph, depolarize the cell membrane, and cause voltage-gated calcium channels at the base of the hair cells to open. The resultant influx of calcium ions leads to a release of neurotransmitters into the synaptic clefts. This causes the afferent fibers to respond by undergoing depolarization and increasing the rate of firing in the neurons. Simultaneously, on the opposite side, that is the right side, the stereocilia deflect away from the kinocilium. This causes potassium channels in the basolateral portions of the hair cell to open, allowing potassium ions to flow out from the cells into the interstitial space. The resulting hyperpolarization of the cell membrane decreases the rate of neurotransmitter release by the hair cells. As a result, the firing rate of the afferent fibers decreases. This change in firing activity is projected to the cerebral cortex, where it is summed with inputs from the visual and somatosensory systems to produce the appropriate conscious sense of rotational movement. The brain stem and cerebellum then use the integrated information to adjust posture and motor activity and maintain orientation. The process of increase or decrease in the firing rate helps in communicating head or body movements to the brain. This synchronization of responses to the left and right movement helps in the process of balance. When the head is straight and immobile, the vestibular hair cells generate a tonic resting firing frequency that is equal on both the sides. The entry of calcium ions through the calcium channels is the key driver of the increase in firing rate. If the firing frequency of one side is changed or reduced due to damage resulting from infection, trauma, or ischemia, the brain will interpret the difference of frequency between the two sides as a movement or actual head rotation. However, this will not be supported by the visual or proprioceptive inputs. This results in patients experiencing a feeling of dizziness or vertigo. Cinnarizin provides prompt symptomatic relief by blocking voltage-gated calcium channels and preventing the entry of calcium ions into the hair cells on the contralateral side. This reduces the release of neurotransmitters, resulting in decreased firing frequency and minimizes imbalance between ipsilateral and contralateral firing rates. However, in some patients, recurrent attacks or symptoms may persist indefinitely in the form of recurrent or chronic vertigo. The possible causes of this could be peripheral sensory neuropathy, poor integration in the central nervous system, as in degenerative diseases or strokes, and in many cases, compromised microcirculation of blood in the inner ear and brain. Cinnarizin inhibits the stimulated influx of calcium into the vascular smooth muscle cells, thereby preventing vasoconstriction. In addition, cinnarizin increases blood flow in the compromised intra- and extracranial areas and the inner ear. This would be especially useful in patients suffering from atherosclerosis, diabetes, hypertension, dyslipidemia, or cerebrovascular insufficiencies. Apart from the diameter of the blood vessel, blood viscosity and RBC flexibility are critical for maintaining microcirculation. The vestibular apparatus and vestibular nuclei are richly supplied with capillaries, known to be devoid of smooth muscles, thus lacking the property to dilate. In order to squeeze and navigate through the capillaries, it is important for RBCs to remain flexible. In ischemic conditions, intracellular calcium increases in the RBCs, reducing the mobility of the intracellular protein interface between the membrane and cytoplasm. This stiffens the cell membrane and decreases its flexibility. The decreased RBC flexibility leads to increase in blood viscosity. Cinnarizin blocks the entry of calcium into RBCs, thereby improving RBC flexibility. The improved flexibility of the RBCs reduces blood viscosity, thereby improving microcirculation in the inner ear and brain. Improved blood delivery to all participating components would help in promoting normal function. Cinerizin, with its benefits of symptomatic relief and disease-modifying effect, can play a crucial role in the management of both acute and chronic or recurrent vertigo. Cinerizin has symptomatic effect that may relieve a patient's symptoms immediately and preventive effect that reduces the possibility of future attacks. Cinerizin helps the human body regain balance and be the incredible machine that it is.